Today I'm doing my IV push and piggyback competency. I'll start by checking the doctor's order. We have Mr. John Smith here. I'm giving morphine and Zantac. I'm giving 2.5 milligrams of morphine IV push every 4 hours for pain. And I'm giving Zantac 50 milligrams IV piggyback every 8 hours for his GERD. I'm going to compare to the MAR. Mr. Smith has no allergies. Everything's matching on the MAR. We're at the right time. This pain medication is due every 4 hours and he can have it now. And we're starting the Zantac, and it is 1 o'clock. Alright. So got that. So now that I've compared that, I'm going to go over to my drug book. The 2.5 milligrams of morphine is a safe dose. It does not have to be diluted, but I'm going to dilute it in 0.4 milliliters of normal saline. You want to give this over 4 to 5 minutes. And you want to, with morphine, you want to watch for respiratory depression. So watch their respirations and their vital signs and all that stuff, because it is a depressant. So, alright. So now I'm going to go over to Zantac, and the 50 milligrams of Zantac is a safe dose, and it is pre-diluted in 50 milliliters of normal saline. And so it's already diluted, so I don't have to do no dilution. It's for, you want to watch their vital signs and their pain level, since it's for their GERD and their stomach problems. And their impaired hepatic can have impaired, it's contraindicated with a patient with impaired hepatic or renal problems. So you can watch their output and all that. So now we're going to administer that over 15 to 20 minutes, and we're doing it over 20 at 25 drops a minute. Okay, so I'm going to go back to the med room, wash my hands, and begin to prepare my medications. I'm going to start with the morphine. Grab my 3 milliliter syringe. Grab my morphine, make sure that's right, 4 milligrams of milliliters. So we're going to use 0.6 milliliters of the morphine. I'm going to use an ampule of normal saline. And both these medications are compatible with D5 according to the drug book, and it's also compatible with normal saline. So we're going to start with that. So I got that. I'm going to go ahead and take my top off of this, of the normal saline, my dilute, and have that ready. I'm going to scrub the tops of both of the vials for 15 seconds. Scrub the morphine now for 15 seconds. Okay. Oh, dropped it, so I'm going to get a new alcohol pad and read, just in case something contaminant's got on there. 15 seconds again. Alright, place it back. Make sure not touch anything. Open up my syringe, put it back to the side. I'm going to pull back, take this top off too. That's the wrong thing. I'm going to pull back 0.6 milliliters of air and put it into my morphine so that I'll have that pressure in there when I'm ready. And I'll also pull back 0.4 milliliters of air and put it into my diluent, which is normal saline, and draw it, go ahead and draw it up. Get no bubbles in there. Make sure it's all good. .4 there, make sure no bubbles. 0.4, put that to the side. Take my morphine and pull up 0.6, which will be equivalent to 1 milliliter. Keep that to the side. Recap. That is 1 milliliter of solution. Now I'll go ahead and label my syringe with the patient's name, with morphine, 2.5 milligrams, which is diluted, with 0.4 milliliters of saline, and it's in 6.6 milliliters. And I'm going to got my name on there because I made the date, the time, so it is ready to go. I'm going to place it to the side over here. Now I'm going to prepare my Zantac IV piggyback. Got my solution. Make sure it's the right, it's 50 milliliters. Prepare my secondary IV tubing. Pull it out, make sure it's clamped. Undo the top there. Now I got the bottom with the cap still on so that it is nice and clean. Okay. Going to spike the bag. Make sure I don't touch it. If I was to touch it, I would get a new bag and restart. Alright, got that, and I'm going to hang it right here so that I can get my line prepared and ready to go. Drops in there. Make sure there's no air bubbles in my line. We're good there. Okay. So now that both of these medications are prepared correctly, I will now go into my patient's room. So I'll come out and introduce myself, tell him that I'm coming in to give him his morphine, which is an IV push medication for his pain. I'll make sure his IV site looks good, no redness. I'll tell him to report any stinging, any itching or anything when I'm administering these medications. I'll also identify the patient with 2 identifiers. I'll ask him his name and date of birth. I'll also ask him if he has any allergies. No allergies. So I'll go ahead and perform hand hygiene again. Put on gloves. And I'll check the IV line. Make sure it's all patent nice. And I'm going to drop my bag of solution down below and watch for flashback. And we have flashback, which means that the line is patent. Rehang it. Okay, so the first thing I'm going to administer is my morphine, which is over 4 to 5 minutes. So I'm going to grab another alcohol prep pad, and I'll be using the closest port to the actual IV site. I'll clean it for 15 seconds with an alcohol swab. Okay, throw that away. Then I'll take my morphine. It's over 4 to 5 minutes, so I'll prepare it. And I will clamp off the tubing right there. Make sure I put that on there without touching the edges. And over 4 to 5 minutes. So what I'll do is I'll put about 0.25 milliliters in every minute. So for the first minute, I'll put 0.25 in, unclamp and let it sit for a minute. After that minute, I'll clamp again, go down another 0.25 milliliters, then I'll unclamp again for another minute. And after that minute, I'll push another 0.25 milliliters, then unclamp and wait. Then after that minute, I'll clamp it again and administer the last 0.25 milliliters and then unclamp. He reported no stinging, nothing. I don't see any redness or anything outside of the site. Undo this. These will both go in the sharps container. And then he's ready to go with that. He reported no redness, no stinging, no itching. And now I'm going to prepare his IV piggyback medication, Zantac. I already have the label on here. It's got my name and date of birth. It's got my name and the date and the time. And it's got what's all in it. It's got Zantac 50 milligrams in it. There's a 50 milliliter solution. It has already been, there's no bubbles in the line. So I will be using the closest port to the bag for this medication. So I'm going to go ahead and hang it. And I'm going to drop the primary IV line after checking to make sure it's patent again. Drop it below to make sure there's flashback, which there is. So I'm going to go ahead and drop this line below this hanger, below my piggyback. Put the piggyback, undo the cap, the closest port to the bag. I'm going to go ahead and clean it for 15 seconds.
I got 60.
Okay, drop it. Then I will attach this, making sure not to touch anything on the outside. Start this line. Open it open, and the 25 drops a minute. I'll be doing just about 6 every 15 seconds until I get ready for that. So I'll start counting. That should be about right. Starting now. I'm actually realizing it's a little bit too slow, so I'm going to count again. Okay, that should be about right. Starting now. All right, that is 25 drops a minute. So I'm gonna let that run for 20 minutes. Gonna make sure he's fine. No, I don't see any redness or edema around the site. He has not reported any stinging, and I'll tell him that if he does, he's to let me know. No stinging, itching, anything like that. So I'm gonna take my gloves off, perform hand hygiene, and leave the room. Okay, it's been 20 minutes now. So I'm gonna go in here, the infusion is done. So I'm gonna come in here, perform hand hygiene again, make sure I have the right patient name, Mr. John Smith. You tell me your name and date of birth. No redness or edema around the site. Going to reapply gloves. Everything goes, should be. If I can get the gloves on. After I got my gloves on and made sure everything was good, name, date of birth, no redness or edema, it seemed to be going as it should. I'll come back to my piggyback infusion and make sure I clamp it off and unattach it. This can be thrown away. I'll raise the primary bag back up and I'll set it to however the provider had it ordered before. Now make sure he's comfortable, doesn't need anything. Make sure if he feels has any weird effects, if he has any trouble breathing, or if he has any pain, severe pain, or really any pain anywhere on here, he'll let me know, and I'll come back and check on him. So now I'm gonna go document.